its consequences.
You need the support of the community. So what I've seen in Main Reef is that component of not only if we want to look at in terms of the support of the communities, but the involvement of the community themselves, because you just capacity building the community to look after themselves. So that in itself is actually an element of poverty alleviation, because you know that HIV is also driven by poverty. So you're taking these young people out of their wrongdoings and capacitating them to look after themselves, therefore to look after others.
It's that methodical, systematic way that you plot out every single house in the community, and you assign people to go to each and every family and to speak to every single person. And you have this saturation coverage, and it's systematic. It's absolutely systematic from beginning to end. And that is the only way in the end that we're going to beat AIDS.
During the 3-year TCE program, individuals and families make a personal commitment to take control of HIV and AIDS. Are the field officers themselves in control of HIV and AIDS?
I'm HIV positive and I'm using a condom. I know my status, and even my family, they know everything about me. Even my child, he can say, "Oh, Baba, please, man, now is the time for your medication. Please, check your time."
Volunteers called patients, local leaders, NGOs, and local community-based organizations are trained to build and maintain structures that help to keep that control.
As a director, as well as a founder of this organization, they actually assisted me in terms of administration as well. They were not only looking at the caregivers, they were looking at how I do things. I used to come to them and they definitely helped me. As a result, I'm actually, more fluent, if I may say it, or I know now how to present, because I used to look at them when they do the things, and I've learned a lot from their presentations. I used to just send my administrator with one check to go and withdraw the stipends that I have to pay 50 people. And they told me that no, that was incorrect. I have to give them checks by individual checks. So since that I know that I can account in the account for, and the auditors don't have stress now, it's easy to account for individual checks. TCE were my mentors. They were actually mentoring the Bitoko home-based care, and in so much that they actually encouraged me to do food gardening. As a result, we are having a vegetable garden at the back of our yard, and our people living with HIV, they do benefit from the veggies that they are actually plowing themselves.
TCE works closely with the Department of Health in South Africa to prevent the spread of HIV, as stated in the National Strategic Plan.
On the 16th of June, they make an event very far above that mountain. I went with them. Then I've gone to test many people. So that place I didn't reach. I'm having years working here because we are short-staffed. We didn't even try to go that side, but TCE managed to penetrate up to that far.
TRIO is a system that works as follows. A field worker would be sent to a household where there's an infected person, male or female, and the family becomes the affected. Apparently, a request is made to the patient in terms of being given information on HIV issues, their understanding, how it's affecting them, who they like to disclose their status to family members, or are they having difficulty in terms of dealing with how the families will respond in terms of hearing that they are HIV positive. However, once the client has agreed into getting to the system, the field worker will sit down with the client, counsel the client thoroughly until the client gives a informed consent that now the family can work with the client.
The one-to-one support that they're providing is essential, both from the prevention point of view. It's essential that you get someone coming to you. It's a human side that being provided, and the support and that being provided for those that are not infected, and who we need to make sure that they remain uninfected. This is indeed one of the pillar or objective in terms of our strategic planning, as well as the national operational plan, that we want to remain, to make sure that the 42 million of South Africans that are negative remain negative.
Humana People to People, through TCE, works closely together with health professionals, the local leaders, business people and politicians in the fight against HIV and AIDS in South Africa. We hear from them what impact the TCE program has had so far.
Since its arrival as TCE, we saw a lot of courage, we saw a lot of techniques, strategies and new approaches, like the one they call PAS, and the house-to-house approach that they're doing, it has actually brought a lot of impact, because we're able to reduce new infections, they were able to encourage people to disclose, hence they're also participating in the what you call local AIDS council of a municipality.
There is a change. It was not enough for me to cover the whole community, giving them information on HIV and AIDS. So TCE is helping us, and then we see a number of clients coming voluntarily because they got information from the TCE people.
Humana People to People has the expertise, the will and the capacity to implement TCE as a nationwide program in South Africa.
I think the buy-in of the government is essential, because that will open the doors for funding like PEPFAR and UN and EU and all other funders can maybe contribute to that effort.
Humana People to People South Africa invites potential partners to join hands and support TCE with the resources necessary to implement this intensive program.